Okay, so first off, everybody knows that I talk really fast, so I am trying my hardest tonight to talk at a slower speed that will be helpful, because if I talk really fast, that's not going to work. So, what I've decided to talk to you all about tonight is aneurysms. And I've decided to talk about them. I decided to talk about for two reasons. First off is that I'm a huge medical person. I'm doing medical interpreting for my internship, and I just like it. I think it's interesting. Second off is because my boyfriend Chris, his dad, about 2 years ago, had to have surgery on an aneurysm, and he had a lot of complications from that, and so now I know a whole lot about them. So, first off, I want to ask all of you, have you all either experienced or known anybody that has experienced an aneurysm before? 1, 2, 3, 4. Okay, few. Good. Cool. Good. No. Good, but you all know about that. So,
good for your family.
Yes.
I thought you died if you had an aneurysm. I didn't make you fix that.
There is a difference between having an aneurysm and having an aneurysm that ruptures. So I'll talk about more about that in a couple seconds. So first off, let me describe what an aneurysm is. An aneurysm happens when you have a blood vessel, like an artery, and the wall of the artery is weak, and so it starts to balloon outward. And that's dangerous because, you know, if you have a balloon and you fill it up too far, it'll burst. And so imagine that balloon filling up with your blood, and if it bursts, then that's really bad. You can bleed a lot, and you can possibly die from it. So that's basically what an aneurysm is. Do you all know where the most common place to have an aneurysm in your body is? Megan?
Brain.
Wrong.
Down. I'm going to go leg.
Wrong.
Heart.
Correct.
Ooh, second try.
The most common place for an aneurysm to happen is in your aorta, which is the biggest blood vessel in your body. And most people think your aorta just comes right off of your heart and stops in your chest. No, your aorta goes all the way down to your pelvic bone, and it's about the size of a garden hose. So think of that huge blood vessel going all the way down, all the way to your pelvic bone. So you can even get, the most common is in your aorta in your heart, but you can get them in your aorta in your abdomen, closer down to your pelvic bone. Yes?
You said it's the length of about the size roughly of a garden hose, so does that mean like it snakes all over the place?
It doesn't snake, it's just the diameter. It's just about this big.
Oh, okay, I got you.
And so, not the length of a garden hose, but about that size. I'll put that.
Where did you say it's going?
Your aorta starts right off of your heart. Your heart is, this is hard to do because she's interpreting it, I'm trying to show. Your heart is right here. And your aorta starts right here, comes off, curves, and it goes all the way down. And it's the biggest blood vessel in your body. You can have.
Question. If that aorta bursts, how long do you have to live until you're not living anymore?
It really not so much depends on time that I know of, but it is a medical emergency if that ruptures. And the death rate from an aortic aneurysm rupturing is about 90%, so it's pretty high. Okay. So, like I said, when you have if your aortic aneurysm ruptures, then it can cause heavy bleeding, which can cause you to go into shock, or most likely you could die if your aortic aneurysm ruptures. If you have an aneurysm in your brain and it ruptures, that can cause a stroke. Strokes can be caused by two things, and that's one of the things that can cause a stroke. So the bad thing about aneurysms is that a lot of times they don't have symptoms. And so most people...
Can you say that again?
Oh, sorry. The bad thing about aneurysms is that most times they don't have symptoms. So somebody could have an aneurysm in their body and have no idea that it's there. Often the way that aneurysms are diagnosed is they happen to find it when doing another medical test. So Let me see.
Are they genetic?
They can be. Oftentimes not. A lot of times it has to do with your health, but they can be genetic. So if you do have symptoms from an aneurysm, it depends on where your aneurysm is at. So if you have an aortic aneurysm, you might feel like a pulsing sensation from the aneurysm, or it could cause some trouble swallowing, or it could cause some trouble breathing. If you have an aneurysm in your brain, it could cause vision problems and headaches. If you have an abdominal aortic aneurysm down lower in your stomach, then it can cause back pain and groin pain, things like that. But a lot of times those symptoms aren't so obvious as to be an aneurysm. Sometimes they think it's other
Can you say that
causes.
again about the back and the...
If you have an aneurysm in your abdomen, around your stomach, it can cause pain in your back and in your groin area. So that's the problem if you don't have symptoms, is that most people don't know they have an aneurysm until it ruptures, which is normally a bad outcome. So, but aneurysms aren't always a bad thing. You can have a small aneurysm that doesn't grow and stays there and never ruptures, never causes problems. And it can just be there and you can live healthily with an aneurysm. But your doctor will want to keep an eye on that aneurysm and make sure it doesn't grow. Because in your aorta, if you have an aneurysm in your aorta, it can actually grow to the size of an orange before it bursts. So they want to keep an eye on that, and if the aneurysm does grow larger, then they'll probably want to have surgery to remove it. Because if they don't remove it, then it could rupture, which has a high chance of death. And that's what happened to my boyfriend's dad. He didn't die, but his grew large enough that he needed surgery. And most time after somebody has surgery for an aneurysm, they make a full recovery. Some ways really to prevent aneurysms. Most aneurysms are just caused by your health. So the best ways to prevent them are to not smoke. If you're overweight, try to lose some weight. Make sure your blood pressure's okay. Just general things like that. Exercise, eat healthy. Those are the best ways to prevent aneurysms. Yeah, so what happened to my boyfriend's dad, this is about 2 years ago now. He had an aneurysm in his aorta that was small for a very long time. And then he found out that it grew large enough where he needed surgery. And so he went to have surgery, and he ended up actually having about as many complications as you can think of from the surgery. And he was in the hospital for a total of like 4 months, and he almost died a couple times. It was a big deal. But that is why I now know so much about aneurysms. And I think they're interesting. Yeah.
So you said they wait until it grows to a certain size to take it out. Why don't they just take it out as soon as they find it so they don't have to worry about it growing?
Because a lot of times they don't grow any bigger, and if it just stays small, then the person can live without having to have a heart surgery or a brain surgery. And it can be better just to not have the surgery if it never grows. Megan?
How do you diagnose it? Is it an MRI or CAT scan or?
There are actually 6 different tests that can be done to diagnose it. I have them listed. Let me find them. So there are actually 6 that can be used to find it. You could have an angiogram, which is basically like your x-raying the inside of your blood vessels.
Say that again about the angiogram.
It's basically like an x-ray of the inside of your blood vessels. You could have a CT scan. You could have an MRI. They could do a spinal tap, which checks for an aneurysm in your brain, strangely enough. And you could also have an ultrasound of your aorta, or you could just have a normal x-ray. Those are the different ways they diagnose it. But like I said, most of the time, the reason they end up finding it is because of another medical procedure, that they end up just happening to find it, and then they have to diagnose it after that. Any other questions? Yeah.
An aneurysm is a rupture, how does it grow?
An aneurysm is not a rupture. An aneurysm is the ballooning
Okay.
of the blood vessel wall, and then if the aneurysm grows large enough, it can rupture. So that's why an aneurysm isn't always deadly and everything, because sometimes it won't even rupture. It's when it ruptures that it's deadly. Sorry to have such a depressing topic, but I enjoy this stuff.